Hello viewers of the Neuro-otology channel. Today we continue our exploration of vestibular migraine. In previous episodes I examined a range of defining symptoms. Today I focus on a particularly distinctive phenomenon, not present in every case but quite common: Alice in Wonderland Syndrome. This is what we'll unpack today. Lewis Carroll's Alice's Adventures in Wonderland was first published on July 4, 1865. As a child, I adored vinyl records, and one of my favorites was The Tale of Alice. I was captivated by its wonder, and that's where the syndrome gets its name, born from the same sense of distorted wonder. In the story, Alice follows a white rabbit down a rabbit hole, landing in a surreal underground world where she experiences bizarre size changes, shrinking, growing, and more. These distortions are at the heart of Alice in Wonderland Syndrome. Though it often appears in vestibular migraine, it can also occur in other neurological conditions. Today, however, I will focus on its link to vestibular migraine and how these symptoms manifest in that context. In essence, Alice in Wonderland Syndrome is a form of derealization, a state where a person feels disconnected from their surroundings or even their own body. This sense of unreality is a hallmark of many vestibular migraine episodes, both intriguing and disconcerting. Common distortions in the syndrome include derealization, where patients feel the world is unreal, and depersonalization, a sense of being disconnected from their own body. Crucially, these are not psychiatric disorders. Patients remain fully aware that these sensations are illusory, even though they feel as real as any other perception. Thus, while they know they are not losing touch, the distortions remain vivid and disorienting. Some patients lose a clear sense of their body. For example, one individual during a vestibular migraine couldn't see her own hand. She knew it was there, but it vanished from her perception, both disconcerting and frightening. Others struggle with depth and size perception, seeing objects as either enormous or tiny, or misjudging distances, leaving them feeling unmoored. It's vital to link Alice in Wonderland Syndrome to these visual disturbances. They often form a core component. Patients may also have blurred vision, altered color perception, and a distorted sense of size or space. Some somatic distortions mirror Alice's adventures, like a shifting body shape or objects warping before their eyes. One patient during a migraine saw his notebook distort, turning into a formless mass. Auditory distortions also occur. Familiar sounds may become amplified or warped, making them seem strange or threatening. Alongside this, many patients lose a normal sense of time. Time stretches or compresses, and combined with distorted spatial awareness, objects seem to move at impossible speeds, deepening disorientation. And what we know about the pathophysiology of Alice in Wonderland Syndrome during a vestibular migraine is that the prevailing theory is vestibular migraine disrupts thalamic processing, altering how sensory input reaches the cortex and producing these distortions of time, space, and body image in Alice in Wonderland Syndrome. In summary, Alice in Wonderland Syndrome provides a vivid example of how vestibular migraine can profoundly alter perception. By understanding these mechanisms, we can better diagnose and support patients experiencing these bewildering symptoms. Thank you for your attention.